Venezuela's once impressive medical system has dramatically declined over the decades. The government hasn't released healthcare data in years, making it difficult to know the full extent of the crisis. But media reports, research by NGOs and people working in the sector paint a very bleak picture. Aljazeera's Teresa Bo had this exclusive report in February from a hospital in Barcelona in Venezuela, where at least 14 children had died from contaminated water.
We were allowed to film because staff here say they want the world to see that they are unequipped to save children's lives.
You can see how desperate the situation is here. There's several children on each one of these beds. People are telling us that there's no medicines, that there are not enough syringes, among other things. Many of the children that are arriving here are dying from one day to another.
Marlene Mariño's baby boy was one of them. He was 2 months old. On Tuesday night, he died. His body remains in the hospital because she hasn't been able to get together the money needed to buy a coffin.
In April, Human Rights Watch blamed Nicolas Maduro's government for denying the humanitarian crisis. Blackouts and a lack of running water in public hospitals, plus a major decline in immunisation, have caused a spike in mortality rates, especially for infants. Some 3.2 million children, or 1 in 3, need humanitarian assistance. Viruses and diseases have made a comeback, according to Human Rights Watch. Last year, more than 9,000 cases of measles were registered and at least 74 people died. Now, more than 2,500 suspected diphtheria cases have been reported since 2016. 190 of those are just from this year alone. And malaria rose from 36,000 cases in 2009 to 414,000 in 2017, while tuberculosis has hit an all-time high. And where anti-HIV and AIDS medication was once given out for free, Venezuela is now the only country in the world where 9 out of 10 HIV-registered patients are no longer receiving antiretroviral drugs.